would describe the GCC healthcare situation as dynamic. You've got a population that is very young, whereas in most of the Western nations everyone's concerned with the huge numbers of people over the age of 65 and growing people well into their 90s, whereas in the GCC most of the population are around the sort of mid-20s to mid-30s. The healthcare provision is mixed. You have examples of world-class excellent provision, but it's a patchwork quilt where you have some of the GCC countries with a very good public sector network, others less so. Other countries have very good private provision, others less so. I think in general the GCC has gone from an entrepreneurial approach to healthcare, where lots of doctors have provided care to their patients through their clinics, but not in a corporate and not in a structured way. And the regulators have had in the past a very light touch. What you're now starting to see is the growth of corporate brands, the professionalisation of the delivery of healthcare, so that you have institutions with clinics and hospitals offering similar services to their patients under one overarching brand. You've got regulators taking this seriously, starting to control both the type of doctors that are allowed to come in and practice, the types of nurses, the types of technicians, and also you've got a situation where standards and measurements are being put in place, which means that the safety net for patients, the expectations of patients, is getting better and better. I think with mandatory health insurance being rolled out across the region, there is new funding coming in, which makes it very interesting for operators, and of course it's attracting interest from investors who see this as a growth market over the coming years. Now, when it comes to patient satisfaction, it's the responsibility of every operator, first of all, to measure how patients actually regard the experience they've had at your facility. Patients are very good at judging how easy it was to make an appointment, how they were greeted at reception, how clean the premises was, what was the manner and in the way that they were communicated to by nurses and by doctors. I think it's very hard for patients to judge clinically how good a doctor is or how successful a surgeon is. Often the patient is under anaesthesia with some of these procedures. But as an operator, you need to ask the questions, so you need to capture the feedback on the soft issues so that you know how well the front of house is actually catering and looking after your patients. But at the same time, you need to measure clinical outcomes. You need to look at things like how many times you have to repeat a procedure because it didn't work the first time, whether things go wrong, how many untoward instances occur. And by measuring and benchmarking doctor against doctor, clinic against clinic, hospital against hospital, you can drive up standards and you can make sure that if people have issues, you can put them through retraining. And in the ultimate situation, if you have a doctor who is below average in terms of the outcomes that he or she is achieving, then you can make changes. But certainly it's not an area that you can ignore. I think the outlook for GCC healthcare over the next 10 years is incredibly exciting. In the UAE, we're obviously all focused on the 2020 Expo and the dramatic growth that we're going to see in both the population, the infrastructure, and the provision of healthcare that will go along with that. You have a situation where I think that the funding of healthcare is going to drive market consolidation. If you are an employer and you're asked to provide for the care of your staff, you are facing a very large bill each year that is likely to keep on increasing. I think in the West you probably see health insurance going up at something like 10% a year, even if inflation is running only at 3 or 4%. Now, if you're going to try and curb that cost, the first thing you need is efficiency in the delivery system. So you don't want to be sending patients to clinics or to hospitals that are operating at 25 or 30% capacity, because that means that you're not only paying for the bed that your patient or your member of staff is in, you're actually paying for the empty bed or the empty 2 beds next door. So what you really want to try and do is have providers who are operating as close to capacity as possible, but also then passing on the savings because of that volume, so that they give bigger discounts to the insurers, and the insurers can pass on lower premiums to their corporate clients. So I think that what you're probably going to find is that there will be a continued growth of corporate brands. You'll see insurers merge. At the moment there are over 40 insurance companies operating in the GCC. I suspect that there needs to be no more than 6 or 7 of them. And you need to have perhaps more specialism being introduced. Lots of healthcare is around basic primary care in communities, or hospitals that do a little bit of everything but don't necessarily specialise. And again, I think over the next 10 years you're going to see dedicated paediatric centres, dedicated cardiac centres, dedicated urology and renal dialysis centres, where patients will start to see the depth and the quality in a dedicated centre, as opposed to hospitals pretending to be good at lots and lots of different things, which is hard to achieve. In healthcare, the one thing you can't be is complacent. And with a conference like the Innovation Conference, it's an opportunity for us to get together, to learn and to listen, to see people that are introducing new areas that help improve care for patients, introduce ways of focusing on prevention and education so that perhaps you can avoid diseases actually starting, and also new techniques. Technology is enabling healthcare the same as it's enabling every other aspect of modern life. So we're moving to an era where you might be having a consultation with a world-class paediatrician, and that paediatrician might be in America or the United Kingdom or Germany, and you might be sitting in Dubai. At the same time, your surgical techniques are getting incredibly more sophisticated. Laparoscopic procedures have reduced the amount of intervention when you're carrying out many forms of surgery. Things like cataract surgery, which was a 2 or 3 hour operation per eye 15-20 years ago, is now a very simple 15-minute procedure under lasers. So I think that where you turn up at an innovation conference and you look at what the medical companies, the medical equipment companies are doing in terms of their form of new technology, when you listen to what the pharmaceutical companies are doing in the terms of new drugs, when you look at new ways of delivering care, new processes of operating, it's something that we can all learn from. And ultimately, if we apply good quality care, we invest and we really focus on our patients, we can actually improve healthcare in the GCC, and conferences like this would be great for something to build on every